Am I audible? Is the screen visible? Please mention in the chat box. So hospital administration management, important topics. Page numbers may vary for the new students who have received the new edition. This is according to the previous batch students' old edition. Okay, so we are going with that. If any new students who have received the new edition, you are attending the February exam, please reach out to me to identify the important topics. I'll give it to you. Okay. So this page numbers, chapter numbers, which is mentioned in this particular video, it's according to the page numbers that is mentioned in the old edition of DC Joshi textbook. Okay, the black cover one, Okay, new edition students, I guess you have received the blue cover ones. That is different. The page numbers are different, chapter numbers are different. Okay, contents are almost same. So from the hospital administration book, chapter 10, legal aspects, all topics are important. And even in presentation, all the topics have been covered. You can check the recordings as well. Chapter 13, planning, all topics. It's a small chapter. Chapter 14, decision making, from 78 to 70 to 81. Just focus on these page numbers, decision making. Job designing, it's just one page. Okay, the chapter is entirely one page, just 2 pages. That's it. So just read that. The difference between job enhancement, job enlargement. Okay. Then directing, all topics are important. Motivating, again, all topics. Leadership, all topics, all different types of leadership. Please understand that. Hospital planning, page number 187 to 193, 196, 201, 206, 207. Okay. Those who have the old textbook, these are the page numbers of that. Chapter 29, outpatient department service, all topics. Emergency services, all topics. These are small chapters. Okay, especially focus on managerial issues in these departments. Managerial issues, purpose of this department, functions. Inpatient department, these are the page numbers 224 to 237, and then 247 to 248. Operation theater, all topics. ICU, all topics. ICU is an important chapter. Laboratory, 226 to 266 to 268, 271 to 273. Radiology department, 276 to 282, and focus on what all equipments are used in radiology department in nuclear medicine. Okay, the norms and the certifications, licenses in radiology department, managerial issues in radiology department. Please focus on that. Transfusion services, 292 to 299. The laws and amendment which are there in transfusion services in the previous edition textbook, don't focus on that. MRD, all topics. CSSD, 318 to 324. Housekeeping, all topics. Transportation, all topics. Relatively very simple chapter. Waste management, again, all topics, different types of waste management, treatment, disposal. Occupational safety, all topics with examples. Okay, please focus on the examples of this chapter on occupational safety. Quality in healthcare, what is quality, quality control, quality assurance. Okay, quality control of laboratory services. In the chapter of laboratory services, you have to understand the quality control, quantitative and qualitative. Quality in healthcare, 449 to 453, 455 to 457. In media, only just these few page numbers. Okay, about the different types of media. Okay, different roles of media, how you have to keep your media relations good. Telemedicine, just examples of few telemedicine, why it started. Okay, what are the drawbacks we had before telemedicine and how the telemedicine improved that. Okay, conceptual questions you can expect. Medical tourism, just these two page numbers, 489 and 490. That's it. Then section 9, A1, A5, and A6. This is your PC and PNDT Act, the Transportation of Human Organs and Tissues Act, which we discussed today. Okay, these are the sections. Just go through it. Go through the presentation. What I have shown, that is more than enough. Now coming to the sample questions. These are the two sample questions. You can expect these kind of questions from most of the chapters. 80% of the questions will be somewhat like this, relatively answerable if you have studied the concept of the chapters. Like biomedical waste should not be stored beyond how many hours. Those who have read the chapter of biomedical waste management, beyond 48 hours, you won't keep the biomedical waste. This applies for the infection control students as well. Okay. Recommended number of ambulances under Rao committee for 150 bedded hospital. So per 50 bed, for every 50 bed, there is a rise of 1 ambulance. Okay, so 150 bedded means you will require at least 3 ambulances. So for every 50 bed, there should be 1 ambulance. So 150 bedded, that is 3 ambulances. This is what the Rao committee had suggested. So if you read the transportation chapter, you will come to know about this. Okay. So these kind of facts you have to underline and read it over and over again. Okay. And for all subjects, all the other competition subjects which you have apart from hospital administration, like quality, infection, Six Sigma, okay, and for MHA students as well as HAM students, the other competition certificate courses which you are doing, glossary, acronyms, and tools, please go through it once. Okay, some difficult questions, hardly 1 or 2 difficult questions can come from these areas. Otherwise, relatively 80 to 90% questions comes from the conceptual part of the textbook, theoretical part of the textbook. From the glossary, acronyms, and tools, only some difficult questions will come. Those who have gone through these tools and acronyms and glossary thoroughly, they can answer that questions. Okay.